So let's start the discussion. I repeat the question: to what extent do global and national policies incentivize or hinder collaborative work? Maybe a first question would be, do you have national policies, or does your country have national policies that enable or support your ability to implement integrated campaigns? So whoever wants to speak, please raise your hand. Briefly introduce yourself, your name, your institution, where you work, and your country, and then go ahead and answer the question. So the first question I is, I will repeat: do you have national policies that enable or support your ability to implement integrated campaigns? So please feel free, don't be shy. Feel free to speak. I will encourage participation because I think this can be a very lively discussion. So please go ahead and raise your hand. Don't be shy, please. So I mean, I know that there are some countries might have policies that enable ability to implement integrated campaigns. We usually find, or frequently find, that integration is a word that is better said than actually put into practice. I mean, the way the ministries of health are structured, usually they are structured as separate programs. For example, immunization program plus or NTD program, etc., or vector-borne diseases program, which not always interact between them. They have their own budget, their own objectives, their own indicators, etc. But there might be cases, and that is the sense of the question, in which some countries have policies that actually enable the ability to implement integrated campaigns. So we would like to hear about you. Let's go with Ayak, please. Please introduce yourself. Tell us who do you work for in your country? Ayak, please. I think, Ayak, can you hear us? We can't hear you. Ayak, sorry, Ayak Kera.
Yeah, certainly. I was thinking you are asking some other person, Okay.
No, I mean, you can feel free to speak about this question or any related issue that you consider important. Just feel free to.
Okay. Yeah. So thank you very much for this opportunity. And then the question which has been raised is regarding the policies, whether they are there in the countries to support integrated campaign. To be very frank, there is no policy, because this is a new initiative which is being talked about. And I think we as the people who work in this field of, integrated campaign, we have to do a good advocacy with the policymakers. And we have to convey this message very clearly that this is the way forward, this is the cost-effective approach, and particularly in a situation where multiple campaigns are happening. And even there is if you talk to the health workers, they also find, overworked. I mean, as one of the representative from India was making a reference that every month there is a campaign. The worker is busy in either in pre-planning or implementing the campaign. So people are so preoccupied that they are not in a position to provide routine medical care, because campaign, impacts the routine system also. So I think in that sense, there's a high time that we need to convey this message. We need to do a good advocacy. And maybe with this good advocacy, the time will come that the government will come up with the policy. But as on today, there is no policy, to be very frank. Thank you very much.
Thank you very much. I think you mentioned a few important points. Yes, the need for integration, for advocacy, and and the situation where you have countries that have a lot of campaigns running, sometimes simultaneously, sometimes one after another with little time between them, etc. That's a good point. Gaspar, please go ahead. Can you put your camera on just for us to see you?
Yes, sure. Hello, everyone. I'm Gaspar Come, and I'm from
okay.
Well, in Mozambique, we have policies that allow or enables collaborative work, but this has not been very traditional. I mean, in terms of several organizations utilizing these strategies here in the country. And actually, me and my organization, we are doing that. And because there haven't been so many organizations working on that, there are some challenges. Like, for example, communities are not aware of these strategies. What means sometimes it's hard for us trying, for example, to implement collaborative work with communities or even with the government itself, because they find it a new strategy. But in terms of policies, they don't have any problems. We have policies that allow this collaboration. It's only that very few organizations and communities are aware of that. So these are some of the challenges. But yeah.
No, go ahead, please.
Okay. From the experience we are having, I think it is good because one, it allows ownership from the communities when we plan campaigns collaboratively with the community. So this allows ownership in one side, but in the other side, it allows organizations and partners to really learn community problems deeply and the best strategy to address campaigns in general.
Mm-hmm. Thank you very much. That I think that's very important. So what I understand from your statement is that I mean, you have in Mozambique the policies in place, but actually putting them into practice is a challenge and will require a lot of advocacy and a lot of raising awareness, both at the government level and the community level. Does that summarize more or less the
Sure,
the situation? Okay. Thank you very much. So, Richard, how are you, Richard? I know you some time ago, so it's good to see you again. Please go ahead, Richard.
Good to see you, Santiago. Yes, I'd reiterate what was just said in terms of, you know, yes, strategies, country strategies and policies often do have some language with regards to integration of campaigns, interventions, etc. But as was mentioned, it's really sort of that next step of how do you actually implement this, and that's where these strategies and policies often don't have enough detail of specifically what activities should be taken and how it should be then executed. And really there critical is leadership. So really it's the sort of Ministry of Health in most instances, leadership that becomes critical in essentially communicating that throughout all levels so that it's really taken up, you know, at regional, province or district levels where often the campaigns are being planned. I think one element that I don't think we necessarily have discussed is that, of course, when you talk about campaign integration, you often also talk about collaboration and coordination of activities across ministries, right? So
yes,
Ministry of Health and Ministry of Education, for example. And, you know, you have to make sure that both of these ministries, of course, are on the same page and really work towards a common goal. And that in itself can be challenging at times, and especially if ministries operate on different operational cycles. Lastly, what I wanted to mention, what might also be interesting for the Health Campaign Effectiveness Group is that what I've seen, having become recently involved in global health security work, is that in some countries, there are effective platforms that have been established around One Health. And, that's, global health security and the work on emerging infectious diseases necessitates a lot of collaboration between ministries of health, ministries of wildlife and conservation, other entities of government institutions. And in some countries, these One Health platforms have become extremely effective at coordinating and collaborating activities and interventions. And that's maybe something to look at as well of what are some of the best practices they are doing that maybe could be relevant for campaign effectiveness, what we're talking about.
Richard, thank you very much. I think you raised a few very relevant points, particularly the issue of intersectoral collaboration with other ministers such as education, environment, maybe the ministers that have to deal with the water and sanitation issues also. I think that's always challenging also. I mean, if we do have challenges for coordination between health programs, the challenges for intersectoral collaboration are also very important and also very great. So thank you very much. Alan Hinman, please.
Thank you very much.
I
actually, can you hear me now?
Yes, we can hear you.
I actually wanted to call attention to a comment that Sanjita had made in the chat, and think that that's an important point to be brought up at this stage. So let me yield the floor.
Okay, so would you like Sanjita to?
Yes.
Sanjita says no policy makes a difference. It is driven by the financing, and the biggest culprits are the major financiers who are more focused on getting the results, whether it breaks the systems or not. So the question should be, how do we change this institution? Actually, that's a good question, and that leads us to another point of discussion that is, this is related to the point of to what extent is actually financing a barrier because of these reasons, maybe, if Sanjita can further elaborate on that, or because of other reasons. So Sanjita, I'll give you the floor to you, so if you can elaborate a little bit more on this point.
I think I just want to say that we spend a lot of time trying to work out the intersectoral relationships and sectoral relationships within countries, when really the driving factors are really the Gates Foundation, the USAID, the DFIDs, who actually finance these projects. When I was working on a campaign with PMI, basically they were so interested in getting their bed nets out, they didn't care if it broke the system or not. And so this is kind of the attitude of the financiers. And so for me, I think we really should be questioning not policies in country to strengthen them, but how do we change the financing that's coming through? How do we change these people who are really creating the major? If we don't change the top block, we'll continue to be doing the same thing again and again. So that's all my point was.
Santiago, you're on mute.
Sorry, I think I was muted. I think this is a very important point. As you mentioned, Sanjita, we have also to consider the global policies. That means maybe the global policies as said, for example, in the WHO NTD roadmap and other international organizations, but also the funders. Usually, as you say, the funders set up their priorities, and not always they do consider the possibility of integration. Alan, would you like to add something on that? I see you have your hand raised.
No, I'm sorry, I didn't drop my hand, but I see that Ajay just made an important additional point, which is that not all countries depend on external donors.
Yeah, that's true. Absolutely. Not all countries depend on external donors. Usually, well, many countries or countries have their own budgets, and sometimes external funding is sort of supplemental funding, but it does come with certain certain requirements or certain conditions. Anyway, it is also a challenge to, I think, and maybe your thoughts on that would be welcome, to even if the country has its own financing, there is still a challenge to integrate between health programs and between sectors, as was mentioned by, before, yeah, it is. But I think that the role that international partners have and international funders would be also very important, and they could actually maybe start promoting or the integration, so that the health campaigns increase their effectiveness. Maybe do you think we've mentioned a couple of things about the overcoming the barriers, but also, for example, the COVID vaccination that we've seen. Has it been, or do you think it can be an opportunity to roll out collaborative work? Is there are there any thoughts or opinions on that? I mean, we've been all suffering the COVID pandemic during the last 2 years, and the rollout of the COVID vaccination provided eventually an opportunity to integrate with other health actions. But did that really occur in some parts, or can we still take advantage of that? I would like to hear some thoughts about that. Any thoughts on that? Do you have any? Yes,
this
please.
is Alan Hinman. I'd say that the COVID vaccination has in fact necessitated integration of activities in many areas, because so many campaigns were postponed or canceled because of COVID, that in order to try to regain ground, it's going to be essential for programs to integrate activities.
Yeah, okay. Yes, actually, in at least in the Americas region, for example, many of during 2020 particularly, almost all the countries suspended or postponed their MDA activities, for example, for deworming, for onchocerciasis, for lymphatic filariasis, etc. So that is something that eventually could be integrated with COVID vaccination, because we are aiming at the same populations, especially in those populations that are very hard to reach. For example, in the Americas, in the Amazon region, it is the cost of getting to the communities is very high. So we must take advantage of the opportunities to get there and provide other health services, and that's been done to a certain extent. So I think it is a good point. We still have a few minutes. I think we have about 2 minutes before we break out, and maybe you could comment a little bit, if somebody wants to comment, on what can the coalition do to enable and support the changes that we would like to see in order to have a better integration of the campaigns and a better campaign effectiveness. Any thoughts on that?
AJ, this is Carol McPhillips Tangomite.
Carol.
I was wondering, I was following the chat, and Sanjita, I see the question that you put in about performance measures for funders or financiers. And I wonder, is that could you say a little bit more about that? And in particular to Santiago's last question, do you see any role that the Health Campaign Effectiveness Coalition could play in that?
Yes, so I think instead of focusing on, again, the countries, I would say that we should, as a coalition, should be advocating and say, if financiers are really serious about integration and effective collaboration, then they should be measures like their financing and their grants. We should be measuring how well are they aligning to those goals themselves. I think there should be an independent organization or even the coalition, pushing back and say, okay, great, we all agree with this, but if we look at your own grant request, that's really pushing us to do vertical work. And that in itself should be, so there should be some measures put out there that not only goes downwards, but also upwards.
Hi, so
Thank
this
you
is just
very
Russell
much.
from MYT, just to give you a 2-minute warning. So change over.
Okay. Okay, we have a 2-minute working, sorry.
The point which is being talked about, measuring the progress of the finances, I think the point is that we need to do an advocacy even with the donors also, not only with the local governments, local authorities, but we also continue to do that advocacy. That integration is the way forward. So that's my suggestion.
Okay, that's a good point also. Thanks very much. So any other comments about this or about the general issue on how to to what extent do global and national policies incentivize or hinder collaborative work? Which is the topic we were addressing here in this session before you go to the next topic.
Santiago, sorry, I'm having a hard time with finding my raise the hand. Chris Sarlis here. So just a bit of an FYI in terms of the financing piece. We are currently supporting a landscape analysis on campaign financing practices and policies. And so that's going on right now. We're working with Consultant Results for Development to do this landscape analysis, to hear from the donors, implementing partners, as well as country representatives. So if you've got something to say on this, we'd love to reach out to you. And then we're convening the representatives from several of their leadership team and donors in May to talk about the financing aspects. So again, any suggestions and asks that you have for us to communicate to them, please send them my way. Thank you.
That's
Looks
a
like other
very
people are
good
coming on.
point, Christine. So I think we're going to return now to the main session. So thank you very much to all of you for your participation. I think we have very good points here, and we will go to the main session now. Thanks. Okay, thank you very much, Debbie. So just to briefly summarize what we discussed, we're going to discuss now in this group the second item, or the second question, which is, to what extent do global and national policies incentivize or hinder collaborative work? The group that we just finished the discussion on mentioned a few points that I consider important. I will just mention what I consider the most relevant ones. First of all, it was mentioned that in many countries, there are no national policies that enable or support the ability to integrated campaigns, so there is no need to advocate with policy makers. And in other countries, there are the policies are in place, but it has been challenging to implement them. So they have been implemented either partially or not at all, but still there is some challenges to implement them fully, because it was mentioned that sometimes neither the governments nor the communities are fully aware of these policies. It was also mentioned that there are difficulties not only in integrating with other programs, with other health programs, but eventually with other sectors such as education, environment, water, sanitation, etc., which are also very important to include and to integrate for the integrated control of and elimination of neglected tropical diseases within that concept of One Health, no? And finally, it was also something that was discussed to some detail was the role of the financiers, because it was mentioned that financiers usually fund very vertical programs, and they do not, especially external international financiers, donors, don't are not very keen on funding integrated campaigns, but rather vertical campaigns like MDA for LF, for example, or for ONCO, etc. So there not much room for integrating with other health programs there. So some advocacy was recommended with even with the donors, and finally it was also suggested that some mechanism to sort of measure the impact of international funding and health effectiveness campaigns and performance measures and financiers for integrated campaigns should be used. Christine Sarlas at the end mentioned that they are doing a landscape analysis on financing and competing financing and analysis. So they are doing some of this work still, but which is good. But this was also an important point that was raised. So that's more or less a brief summary of what we discussed. So now we can take it from there and hear your comments. So I have Ilian Shuku. Sorry if I mispronounce your name. Please go ahead. Ilian Shuku. Please,
Sorry,
can you introduce yourself? Tell us who you work for and your country.
It's actually an old hand. I was going to drop that, and but I can just chip in something quickly. I was typing into the box. My name is Ihani Uzoma. I work with eHealth Africa, and one of the things I just wanted to put out there as we discussed why integrated interventions is actually the possible challenge around multiple policies across different health programming activities. We probably need to start integrating at that level where we have combined policies first before we can begin to look at effective decision making at actually integrating at those lower levels. So that's another challenge we probably have to think through as we discuss this. How do we also integrate these policies such that they will be easy to implement at the lower levels? And how do we actually also involve the lower level decision makers at the community level to also contribute effectively to how best these policies will work in their communities? Else we will only just have policies there that are on paper and can't be implemented. Thank you.
Great point. So you do emphasize the importance, which is crucial, of involving the communities in the first place, and involving them actively in the health campaigns, which I think is necessary for success of the campaign. So thank you very much. That's also a very good point. And now, so the question that the question here is Aime, who is our note taker, very kindly typed it in the chat, is to what extent do global and national policies incentivize or hinder collaborative work? That's our overarching question, let's say, and maybe some related questions to help us address this is, for example, again, are there national policies that enable or support your ability to implement integrated campaigns? So I already commented some of the points that were raised by the other group, but if you have something that you could that you would like to complement this with, please let us know.
Sí, qué pena, yo me tomo la palabra. Muchísimas gracias.
Yeah, thank you so much. I would like to add to it another difficulty that we have is ignoring, as part of this policy, the minority populations. And as in the case of indigenous populations or Black populations, and their vision, their beliefs, and that's something that shouldn't be ignored.
Thank you very much. Muchas gracias, Johanna.
Thank you, Johanna. That is another very interesting point. And that shows the need and the importance of taking into account the culture of the different ethnic minority groups and their cosmovision, especially those of indigenous people, Black, African descendants. Those are usually relegated and they do not take them into account at the moment when decisions have to be made. From our standpoint, from our own culture, they need to be taken into account without having a prior process to be able to understand their point of view. We wouldn't be able to do a better integration. So thank you so much, Johanna. Alan Brooks, please.
Alan?
Yes, I'm sorry about that. I am away from my desk, so I apologize for not having my camera on. I'm Alan Brooks with Bridges to Development, and I fully agree with the financial comments made earlier and the intended or unintended influence that donor focus, let's say, brings. I want to call out something that I actually haven't heard people raise previously, which is some of the perhaps unintended but inherent bias in the guidance and normative documents that are written by normative agencies, whether it's WHO or others. And here's a question for you. Who writes those documents? Who writes the technical guideline that says, do an LF, MDA in this way, or a polio campaign in this way? They tend to be written by people who are subject matter experts, deep technical experts in LF or in polio. And so they'll put a little chapter or a little few words at the back that says, oh, by the way, integration is important. So here's a thought provoker, because when you ask a technical expert to write a guideline or policy on a campaign, they're going to write it from what they know. So the thought provoker is, what if we shifted to have all of our guidelines, normative guidelines, written by behavioral scientists, by anthropologists, who went out and talked to the technical experts, heard what they needed to hear from them, but then actually wrote the guideline in a way that spoke to the behaviors and the how that is so often the under or the missed piece of an effective or high quality integrated campaign. Over.
Yes, Alan, very good question. I will answer it from my experience, and I have participated in the writing of, I don't know, 4 or 5 guidelines, PAHO and WHO, and we have a very well structured for guideline development. Even the guidelines for guideline development are published and are available for everybody at WHO's website. But usually, of course, there is a group of technical experts that participate in it, but usually program managers are also involved. And sometimes, I cannot say that always, but sometimes professionals from other disciplines are involved. So, but that's a good point. I think that it's a good suggestion to encourage the participation of social scientists, behavioral scientists, etc., that could be part of this guideline development, what is called the guideline development group, no? That is the core group of technical people, program managers, etc., that actually develop the guidelines. Developing guidelines at WHO is a complex process, but it has to be so because the guidelines need to be based on evidence, but also on other considerations, on feasibility, on cost, on ethical considerations. Usually there's always in these guideline development groups, an ethicist to look at the ethical aspects, etc. But yes, the process might, I think there might be room for improving, and your suggestion is welcome. So Eva, please.
Really interesting comments, and apologies if my internet is unstable. But in terms of the question about the global and national policies that incentivize or hinder, I immediately, in thinking about the 8 case studies, I thought of course, in Pajo region, Santiago, I don't know if you or others that are from the Pajo region, of course, Juana and others could talk about how your policy framework, which I understand is very strong, has been helping, some of these integrated campaigns move forward. But then also colleagues from Nepal, I understand there is a national health policy in Nepal that really favors integration, and the question there is more how to get it done and resources. But if there's any colleagues that want to expand on that, thank you.
Yeah. Yes, we have this decision with this initiative at Pajo, and the disease elimination initiative, which aims at eliminating a set of diseases, including some of the neglected tropical diseases in the Americas, but by 2030, through an integrated intersectoral and interprogrammatic approach. This initiative was launched in 2019. Unfortunately, well, you know what happened afterwards, and there is much progress. There hasn't been much progress because of the COVID-19. But it is still a challenge, I would say, as I did mention before, to effectively achieve or effectively integrate programs, health programs, and more even integrating other sectors different than the health sector. Yes. Yeah. So maybe so let's see if I mean, is there any comment on global policies to incentivize that can incentivize or hinder collaborative work besides the national policies? Can financing be a barrier? For example, both national financing and international financing? Any comments on that?
Sí, yo tengo un comentario.
Yes, go ahead.
I do have a comment, yes, in reference to national and international policies. And I believe that an element that we need to work to make an effort on is to really disseminate this national and international policies. They exist, but they're not known in the countries themselves. So we need to emphasize this, not only at the ministry level, but also at the local level. So we can take from there elements that can be implemented in the regions and territories. And I'm speaking especially on behalf of the Americas region, where policies possibly exist, programs exist, but there is a total lack of awareness that prevents the implementation of interventions because of the knowledge that communities have, which lacks some elements and which leads to make mistakes. So this learning is necessary to learn this and to disseminate these policies. One way to do this is to incentivize more training in different regions of the world. Thank you.
Thanks very much, Giovanna, sorry. Any other comments regarding this? Maybe we have also had this during these 2 years, the COVID pandemic, as you know. I would like to know your thoughts if, on, for example, how could the vaccination for COVID could be an opportunity to work collaboratively if the rollout of the COVID vaccination can open some opportunities for doing some collaborative work or collaborative campaigns, etc. Any thoughts about that? Okay, so Ricardo, please.
Well, I'd like to share the
Ricardo.
experience in Colombia. Thank you, Santiago. My name is Ricardo. I also work for the University of the Andes in Bogota, Colombia. And I would like to share the experience in Colombia that during the last couple of years, maybe 5 years, most of the calls for proposals coming from the Ministry of Science, including some calls for proposals during the COVID pandemic, incentivize a collaboration from, let's say, top institutions or recognized institutions or research groups with experience with people and hospitals or institutions in the regions that normally didn't have a lot of infrastructure. So a lot of the money was spent raising the level of infrastructure and the quality or the training for people working in the region. So for example, before we didn't have enough laboratories with experience in molecular biology in the regions, but now because of the COVID pandemic, I think that there are more than 30 or 40 laboratories that were open in different small towns or medium-sized towns that in the future could be useful to study some other different conditions, some other different diseases. So this is an example of using a real challenge, such as the pandemic, to raise the level or the infrastructure in the communities. However, there are some limitations of this strategy because most of the money was spent on the regions. Maybe research groups that had experience and were located in major cities didn't have any support for the research. So my idea is that we somehow have to find opportunities to motivate and to incentivize the collaboration in small towns or in the regions, but without forgetting giving support to the people that already have the experience. Because I think that is in this intersection of experience with needs, is that we'll be able to solve a lot of the problems.
Thank you very much, Ricardo. Mandy?
Just quickly,
yes,
I just want to let you know you've probably got another minute or minute and a half until everybody else joins you. But I'll let you continue, make the most of your time.
So Mandy, please, you.
Hello.
Thank you. Hello, Mandy.
Je travaille en Guinée.
I work in Guinea, but I think the COVID pandemic was the opportunity to bring support and help. And I think that as technicians, we can fight to see how we can capitalize with this regarding the cold chain, vaccine, mobilization partners. And I think this is an opportunity that was brought to us despite the policies. I think we can capitalize on this. And lastly, I would say that we are very hopeful that we are going to see the end of the COVID pandemic, and we will go back into a routine work, and we will have that basis to reinforce the integration and the integration of campaigns. Thank you.
So thank you very much, Mandy. Merci beaucoup. So what I think we don't have much more time, so I would just like to thank you all. I think this has been a very lively discussion, and thank you all for all your inputs, and I'll try to summarize the best as I can in the next in the plenary session now. Okay.
Hello.
So,
Hello.
yes.
Can I add a little bit about the Nepal policy?
Of course, please go ahead, Sushil.
So in Nepal, we have the national level policy. regarding the integration of the campaigns and the programs, different health programs. According to the policy, the local level should integrate all the programs together. However, I mean because of the transition phase, the policy is still, I mean, it's not fully implemented in the local level. So in future, I think all the program will be integrated.
Great.
The
Thank you very much.